is to have some of the members um, become part of that committee. The board itself is on those committees. Some people are on more than one. And we're trying to promote some of the membership to come in so we can get your viewpoint and perspective on things. Chris Tabb is chairing our communications committee and now working with Susan and with Meredith on putting together concerns about communications. I'm hoping Chris can come to the next board meeting to share his perspective on certain things that he would like to share with the board. Lucas is working on the activities committee, and Eileen Bischoff and Haley are working with him. And the finance committee is already set up with Jimmy Morrison and Kristen working, and myself and Susan chairs that committee by bylaws. And Colin is our vice president, and he is starting and going to be looking for some volunteers to work with a strategic planning committee. And Justin Kaiser will be on that committee working with Colin. Did I miss somebody else, Colin, that was on that committee? Justin and
Eileen Bischoff.
Eileen Bischoff. Sorry, Eileen, is on that committee. So hi, Ann Korn. Welcome to our group. Susan mentioned that you had something that you would like to share with the group before we break into our breakout rooms.
Yes, I really would. Thank you for giving me a few moments. I've been working with Josephine Wilson, a professor at Wright State University in the Boonshoft Medical School. And I've been on an expert panel related to the use of AR technology over virtual technology, meaning taking augmented reality and imposing it on top of virtual reality environments. What this does is it allows a person in a VR environment. I'm so sorry about that. Let me get rid of it. Okay. It allows you to go into a virtual reality environment and alter the lighting, the contrast, the distance, and so on. And they're looking at people with albinism. So in work environments. So now we're going to try to bring it into orientation and mobility and bring it down to middle to high school students. And the actual title of the proposal is Application of Augmented Reality Imposed on Virtual Reality Technologies to Improve Gains in Independent Travel for Students with Low Vision and Blindness. So the first 2 years, if it is funded, is going to be for students with low vision, and the third year we will be working with students who are totally blind. And the idea is, could you imagine bringing a downtown street crossing to a child in a sparsely populated area? Or teaching a student how to get onto a bus and supply the card or fare? Or even you can even walk down streets and teach street crossings. So this proposal has gone through the first round with IES, and we're writing the big proposal now. So what we're looking for are mobility instructors who might be interested in working with students in the study to see whether or not bringing different kinds of mobility situations with different levels of traffic and different lighting conditions, morning, noon, or night, and so on, into a virtual reality situation is of interest. And so I just ask folks to please, I think the easiest way is to send me an email and I will be in touch and send the information. There's no commitment at this time, only that we ask if a mobility instructor is interested in working with students in a virtual reality environment to let me know.
And what is your email address, Ann?
ANNE123C as in corn at gmail.com. ANNE123C at gmail.com. And you'll may want to know that two other people on the research team are Chris Tabb and Robert Wool Emerson.
Great.
Excuse me, just to repeat that, just trying to put that into the chat. Hi, Ann, it's Lucas Frank. It's ANNE123C as in corn at gmail.com.
Correct.
Okay.
Are there any questions about it?
Well, keep us posted on how it goes, and if the funding comes through, that it'd be an interesting comp, especially reaching out to rural areas. That'd be great.
Yeah.
I'm wondering, this is Mark Carter. I was just wondering what age students you're looking for,
13 through 18.
13 through 18. Thank you.
Good question, Mark. Any other questions? Colin, you have your hand up? Nope.
No, sorry, that was an accident.
Okay.
Okay. It's really exciting. It's like bringing Star Trek into reality.
There was a presentation at SOMA on this. That was quite exciting, and I recommend following up on this. I think it's the way to go. It's sort of the crossover between GPS and Star Wars. It's really cool.
Do have
Great.
one more question, and this is Mark
Okay.
Carter. Do you need any specialized equipment or technology to be able to teach this way?
Yes, each of the students who are in the study will receive, right now we're working with Oculus 2s, which are virtual reality headsets, and they will be able to have their own equipment, and so will the mobility instructor. So that, you can even be a distance from your student and teach that, because you'll both be in the virtual environment with your own avatar.
Thank you.
Great.
Great, thank you.
Okay, thanks, Ann. Come back again and keep us updated on what's happening.
I will.
It's an
Thanks so
interesting
much.
project. Okay,
Bye-bye.
bye.
Thank you, Ann.
Okay, to go back to committee assignments, if any of you are interested in being appointed to one of the committees that I mentioned, why don't you just email me and I will look over who's interested and assign to committees. So thank you very much, people, for taking an interest in doing some volunteer work with OMSA. So now I think we're going to, Lucas has all of us assigned.
No, I haven't yet, but I'm going to do that right now. So there are, just for those of you who are new here, there are 4 possibilities. You can go into a breakout room focused on adults, a breakout room focused on school-age children, a breakout room focused on children under 5, or a breakout room for university and personnel prep folks. And I'm just, I know you all put in a list, but I'm going to do this manually, I think. Becky Keller, which of those 4 would you like to be in? Everybody on mute, because it's going to go quick. Becky Keller?
Yes, the adult, please. Thank you.
No problem. Very dark. Jen Graham? Jen Graham, where would you like to be?
Adult, please.
Adult?
Yes.
Good. Liz Robertson?
Adults, please.
Melanie Bush?
Adults, please.
Good. Carol Lovett?
Adults, please.
Gosh, what a busy. Jerry Darko?
Preschool, if there's anybody else interested, please.
Cherise Roberts?
Adults, please.
Adults?
Yep.
Okay, William, somebody. William?
Hey, so I'm trying to willing to be I'm trying to I'm on my phone, so I'm not showing these three dots to change my name to put my full name in there.
Okay, that'd be great. Which group would you like to go to? Adults, university, children under 5, or school age?
Kate,
Sorry,
can you repeat those?
adults,
Can
university,
you repeat that?
adults, university, children.
Oh, adult. Do you not have anything K-12
Yep.
education or
Great.
yeah, that yeah. All right, thank you.
All right. All right, Eileen Bischoff.
Lucas, it's not letting me move to the group. It was up earlier. Can you send me there again? Which is strange because I have co-host privileges, but it won't let me go.
Somewhere else and then move you out.
Okay.
That's me.
Lucas, Jerry wanted preschool and she's in school age. Should I just jump on over to school age?
Whatever you want to do. Do you want me to, if you
Let
like
me,
to,
Yeah, Jerry's supposed to be preschool.
Okay, let me get you in there.
Okay,
I can
great.
move her over.
Okay.
Should have her.
Okay, not joined, it says, but yeah, there she goes. Now, how do I get back in? I don't have,
Get you there.
here we go. Jerry. Yay. Okay, I can't hear you. Is there?
Oh, hi. Well, they put me in the school age room, so I was having a conversation with Chris Tab, and then I just got kicked out. So,
No, you want to go back in? You want to go back with him?
well, I just assumed it didn't sound like there was anybody else coming to the preschool room, so I went in there and then I got kicked out. So,
Well, we can go back in with Chris if you want to do that.
well, he was just telling me about some apps that he's using with his school age kids, and we were having a discussion about that. So, if there's, I mean, are we, is
It's
this
us too. So if you want to learn more about those apps, let's go back. I can ask Lucas because there are not that many in his either. And Chris's, we can join today.
Oh, yeah, okay.
All right, so let me go ahead and tell Lucas we're going to want to go join with him.
Okay, thank you.
Sure. Well, it says leave meeting. I don't want to leave meeting. I want to leave room. Let me see what we can do. Okay. Yeah, because there are only 2 with them as well. So that would bring 4 for us. Let me see what we can do. Let me get, I'll get my cell phone. And do you see that you can leave the room, the breakout room?
Yeah, I just have the leave meeting also. I can't
Yeah.
leave the breakout room.
Yeah, okay, hold on a second. Let me get, how have you been?
I'm good. How about you? It's been a long time since I've been able to connect.
I know. Well, we've had a few people come in, which was great, but not as lively as when you've been on, of course. because
I talk too much. That's the
Oh,
problem.
no, not at all. No, it's big. Oh, we did have, Grace was on 2 weeks, no.
Wait, yeah, she told me that she joined, and that was the day I had an IEP, I think. I wasn't able.
Oh, well, I'm hoping she'll come back.
Yeah.
Let me see if I can get Lucas here. How are the kids doing?
Pretty good. We're still in person, so that's good. We're getting bored though. We're still not going out into public places. So we're not doing bus travel, and the kids aren't really taking paratransit, so they're getting bored, and it's hard to find motivation to keep them interested.
Yeah.
Like, we used to plan routes and go to coffee shops or whatever motivated them, and that was fun for them. And now it's like, oh, we can't go anywhere. I just give them a random address and we plan the route to this random house in the neighborhood, but it's getting boring for them and
Yeah.
me.
I know. You've got to come up with something, I don't know, but what can you do? Because it's COVID. You can't, let me call him real quick. See if he'll answer. If not, I'll text him. Oh, he's shut down. Okay, let me see if I can try this. Oh, I can do another thing too. Chris, I'll write Chris. You know what? I think I'll ask Chris to do it. He can contact him because he hasn't gone out like we have already. Okay. Any new kids?
I don't have anybody new. How about you? How's your school year going?
Fine. I haven't done any. I went ahead and re-upped, for 5 more years being O&M, but the kids, they're going back to school. They're back in school, and I haven't, picked up any new kids at all.
Yeah.
So, you know, I don't know what they're doing at the home, if they're doing any home visits. There's Lucas. Lucas. Let's see, okay, ask to unmute. Lucas. 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 It's Margie. Lucas.
I wonder if we can write it in the chat. Will we see it?
Good idea. That's smart.
Were you having, you couldn't hear me before?
No, we couldn't. Can we go ahead? We want to join Chris's group because there's only 2 there and there's 2 of us.
Okay, we'll do.
Thanks.
Thank you.
Sure.
All we had was a leave button. We didn't want to totally leave the whole.
I appreciate that.
Okay, great. Did you get the button, Jerry?
Not yet. Oh, there it
You get
is.
Jerry?
I got it. Thank
Sure.
connected.
Hello. Can you hear
Lucas?
me?
Yes, this is Chris. I'm going to try to press stop recording because I don't know if it's my recording or your recording. So if I press stop recording, would you do me a favor just to make sure that yours is still recording? Does that make sense? Yes, no?
There we go. Can anybody hear me?
I can hear you. Can you hear me?
Yes, yes, we can hear you.
Back in business. I don't know what happened there, but I lost everybody for a minute. All right. That was interesting. So many people in the adult group. That was quite something. Colin, we're going to have to give you a dedicated amount of time. That must have been a huge group. What I'd like to do now is, again, just get, and we are recording. I know some people did record. If you recorded, if you could send your recording to me at, I'll put my address up in the chat. I will try and get it up onto the LiveBinder site for this group, which has a smatter of recordings from previous weeks, and especially these summary meetings. We try to get those up every time. So could I ask Colin, you had such a big group. What happened in that group? More of a
Definitely.
detail. Yeah. Mm-hmm.
So we started off the group. Becky Keller made an announcement about the International O&M Symposium that will be taking place this week. Registration is closed, but it is an annual conference for those who are interested. Then we talked about where the status of the vaccinations are depending on the state that you're in, and how has virtual teaching been for you. And we've covered, where different instructors and students are in terms of their priority and where they are categorized in order to get the vaccine, and how that process has been like for them and their coworkers. Then we concluded by discussing some concerns about liability and how to handle that in the future, and discussing how it's been a challenge to teach virtually and making sure that students are still getting a proper education, and trying to figure out how to determine what is essential, because things that we might deem essential, our management or the VR might deem not essential.
Thanks, Colin. Is there this sense of the group? In the beginning of this period, as we were doing these Mobility Mondays, we had a big focus on liability and several presentations related to liability. Is it, maybe we could take a vote over in the chat and see if we wanted to devote another session to that, or develop another group related to liability as one of the breakout rooms as we go. So if you'd like to comment on that, just throw it up in chat. That would be great. University folks, where'd you guys go? There were three of you, I think.
Yeah, so there were three of us, Mark Carter and I, and Eileen Sifferman was in there with us. We were a very small group today. And following what Colin said, we also talked about the O&M conference, the International O&M Symposium, and we also talked about vaccines. So we probably should have merged our groups together for today and joined Colin's. We also, Mark and I were talking about updates on our programs and how things are going. So seems we're pretty much in the same place with our programs, it sounds like. And Mark was talking about he's going to be getting ready to start a new cohort, or they're going to be starting a new cohort. Their cohorts run every 2 years. They start a new one. I shared about FSU. We're still face-to-face. We have been fortunate that FSU allowed us to continue our face-to-face courses for O&M. So we have not had to stop O&M. it is getting tricky to find internship placements. So we still need face-to-face internship placements. One restriction is that we didn't go deep into here, Mark, but one restriction I meant to add is that FSU is asking us to keep our interns closer to home because we can't travel to supervise them. So it's getting really tricky to find face-to-face O&M placements close to Florida or within driving distance of Tallahassee. So that's a little tricky. We also talked briefly about the Ann Corns project and kind of just thinking what we thought about that. And I think we left it as you all can correct me if I'm not explaining this right, but I think we left it at optimistic but unsure where it will go and interested to see where this leads. I think that was kind of the mix. So that was it for us.
Great, thanks, Eileen. Mark, I forgot what program you're with.
Caught me off guard there. Okay, I'm with New Mexico State University. We're out of Las Cruces.
In New Mexico State.
Yeah.
All right, cool. How big a program? How many? What's a cohort for you? How many are you putting out?
Well, it can be anywhere from 2 to maybe 6. Depending. We're pretty small, and yeah. But
Cool.
right now I have 6.
That's a pretty good cohort. That's great.
Well, yeah, and it's interesting because the School for the Blind offers it in tuition for people in New Mexico to take the NMSU courses. And so that kind of limits sometimes our travel out of state, and that kind of stuff. So we have a little different issues maybe sometimes than Eileen has we don't have as many students across the country, although we have had some in Arizona. But anyway, ours tend to be in state.
Great. Thanks, Mark.
Mm-hmm.
The under 5 group was a group of 2, and they elected to join the school age kids, and I'm sure they benefited that group tremendously. Chris, how did it go in your group with that addition?
It went very well. We had a chance to share about things that folks have been doing. We have still some folks who are remote and some folks who are face-to-face. So there's lots of different ways of interacting with students and families across the country right now. But it was a good sharing of different ideas and strategies in order to hopefully keep things fun for students, since we're limited not only in sometimes being physically with a student, but where we can go because of restrictions that schools will typically I don't know if impose is the right word, but place on travel in the community, so that, in other words, we're trying to avoid places of high public travel, like grocery stores that we would normally use for training grounds or buses. Because of the proximity of other people, we try to minimize the number of other individuals that we might encounter. So makes for interesting lesson planning.
Great, thanks. I just wanted to ask Eileen Sifferman, do you want to, in the last mobility, actually the last Mobility Monday was a town hall, and one of the issues that came up big in the town hall, and I think was not a great deal of crossover between that group and this group, but Jen Graham was one of it. It was in both groups. And Jen, I wanted to give you the opportunity to discuss the issue in Michigan with this broader group. And also Eileen and Sifferman, if you want to talk about what happened within our board meeting related to that, and what our next steps are, if any. Go ahead, Jen.
Sure, I can talk about that. Unfortunately, the state of Michigan has decided to reduce our pay by $30 for direct service, and have gotten rid of drive time. And so long story short, there's a group of us that are trying to get some answers regarding where this rate change came from. We're not really sure how much research really went into it, the more that it's being discussed. It supposedly came from an RSA audit back in 2017. requesting some justification for the current rate. But again, there's just, we're not really sure where it's at. And I know that Susan has been meeting with other people. I think there was a meeting today even. I think eventually there's going to be a Zoom meeting with mobility instructors in the state of Michigan, because there are many who have now said they will not be doing private contract with the state. The other part of it that I find frustrating is that this, for certification, if you have certification versus non-certification, it's a $5 difference. And they are not making people within the state of Michigan be certified. So I have huge concerns with that, just because I feel the longevity of our field, you know, the more that doesn't happen, I fear just our field is just going to go away. So I don't have a whole lot to report in terms of movement, but I do know there are more within the state of Michigan who aren't happy. And I can definitely say the list is growing the more that I talk to people. Does that sum it up?
That's great. Jen, Eileen, you have to unmute.
Yeah, several of the O&M specialists in Michigan have put their names in with Susan, and you should have probably a good meeting and good representation. Some of the things that really are of concern to me is that they were told that this was based on some research that AER did, and in looking around, AER has not done any recent research on salary. And the specific for salary is not for those of us who are on a state salary schedule as a teacher. These are contracted salaries and salary hourly rates. So the conditions for their employment are very different than those of us who are like hired by the Texas School for the Blind or universities, where we're usually put on a salary schedule. These people are paid on an hourly rate. And because they do travel, there's always has been a consideration for travel expenditures, and especially with great distances, or compensating the if you don't get the travel money, you know, so much per mile, they usually compensated in the hourly fee, and say for the hourly fee, you have the instruction, you have the travel, you have the report writing and all of that. So we looked into it a little bit more, and what really concerns me is the head of the state agency, Adult Service Agency in Michigan, is also the president of the National Council of State Agencies for the Blind. And so my concern is that there'll be an effect across states. There'll be a, why is it that the person who's talking gets the phone call? I don't understand that. There'll be an effect across states within other state agencies. If you're familiar with the politics of the National Council of State Agencies for the Blind, they've been a rather organized group since the 60s and into the 70s. So I'm concerned that this is going to have a boomerang effect into other state agencies on what they'll be offering to their contract employees. And if you've ever done contract work with the state agencies for the adult services for the blind, there's a real system of it. You have a lot of paperwork to fill out, you have a lot of documentation to do, and it is a career outside of being a full-time employee. It's a really different type of employment. And so we want to give every support we can to the group in Michigan and help them in any way that we can. And I talked to Joanne, who is the chair of the O&M division for AER. And she also is concerned and has been in contact with Susan. And she did and Chris probably is familiar with this because I know she talked to Chris about it. And she did a loose survey, not based on any type of research or just questionnaire, sort of interviewing, and put together something. And so we were maybe concerned that he went off of that, which she was really concerned about because it wasn't scientific. It was meant for her own interest. She did share it at the conference. So she is also concerned about what's happening, and contacted Susan, as she did contrast Chris. So I think Lucas brought up at our board meeting that if both groups like AER, O&M division, and the OMSA were involved in it, that two groups of O&M specialists supporting the group in Michigan, as we might have to support other group of state also, because it's going to have an effect. So if any of you hear anything about the states that you're in with your contract people, Lisa Robinson said she's having a similar issue in Colorado, and yeah, I'm aware of that one too. I wasn't going to mention Colorado, but we've been in contact. We talked about that. So we're putting all this, trying to gather all this information, and let's see if we can have some impact on it. The latest salary schedule that we did with our Northern Illinois University research was on full-time employee type. We didn't look into contract, and a real thorough study needs to be done about the contract we have a lot of O&Ms who are doing contracts. So I think we really need to start taking a position on what contract employees need from their employer and what the salary should be. And in relationship to what we do in Arizona, which is not as expensive place to live as maybe Chicago, Illinois, or maybe even Dallas, or California for sure. There is a difference in the cost of living, which is an impact factor on any salary. So we have to be aware of that too as we look at throughout the whole United States. Anything else? Any questions? Thanks, Lisa. Lance?
I also think there will come a point where, when you look at OTs and PTs, and then you look around you at all the people who are receiving either PT or OT, I mean, everybody knows someone who's getting PT for something. And that's not true except for our clients or students or whatever in the O&M field. We're tiny compared to those organizations. No one knows who we are or what we do. But consumers, I think, have a voice here, and if we as professionals raise our voices, that's one thing. But if instructors start saying, I'm sorry, I can't afford to work with you because I'm not being paid enough, not being paid by my money, it's costing me money to work with you, I can't do it, I'm sorry. And we get people to complain to the soft spot in government that would hear that, and as well as public relations. I think that makes a difference. And I think it's something we should be looking at. Just to follow up for a second, Melanie wrote on the chat that she was interested in being updated on information regarding liability. We can certainly arrange to have someone from the working groups that are looking at liability come in and do a 15-minute spiel at the beginning of the next Mobility Monday or the one after that. But if with all due respect, Melanie, if nobody else cares, we can't do it. So, is anyone else interested in hearing more about where we are with the liability issues related to remote education and other factors?
We haven't really heard from Bill Kaler in a while. I don't know if you've been in contact with him, but if we don't bring him in, you could always send Melody to Bill, and I'm sure he'd be willing to share any information that he has with you.
Anyone else interested, just put it in the chat or raise your hand and talk about. Jerry is, that's great. Anybody else want to hear a little bit more about where we are on the liability questions? There's a bunch. Okay.
Okay, good.
Enough. We'll make that happen. Thanks, Carol. All right. So again, I'm going to stop recording. Anything else from anywhere? Everybody make yourselves visible so we can see each other's. Put your masks on if you're worried about this. Liz, I think I owe you a phone call or an email or something. I can't remember.
I was just with the fee schedule issue. I was just seeing if you had some more information, but it sounds like you guys are still in the middle of that. So that's okay.
Okay, good.
Our next Mobility Monday will be next Monday. And again, we're going to continue to have it at this hour, and which is the East time, 6 o'clock hour. And if you would reach out to some of your colleagues to see if they can make it, and maybe not knowing that we had changed it to this later hour to facilitate more people who are on the East Coast. It is out here it's sort of at the end of the workday in Arizona, but so some of the people like Colin can't really make it all the time because he has students during this time. So let us know. We really want input from everybody on what times we have these Mobility Mondays. As you can see, Susan can't make it at this time, so she sort of kicks us off going into the Mobility Monday, and then she leaves the group. So thank you all for attending today, and we'll hope to see you next week, same time, same place.
There's a question from Becky Keller. If the previous sessions were recorded, Becky, were you talking specifically about liability issues or about other stuff?
Yes, I was talking about liability. I was just hoping to help the other young lady out with just if that knowledge was in our bank of recorded sessions that she could go back and look up them.
There's quite a bit there on liability. If you go, so to do that, to get to that, you go to US OMSA, and then in resources, there's a link to the live binder connected to the Mobility Mondays. It's not organized terribly well, mostly because I'm not terribly well organized, but the also because we didn't know how long this would go. So initially I wasn't labeling things well, but you'll find the liability question is fairly well documented there, and feel free to go in and listen to those discussions. That's well worthwhile. Oh, and Nora's
coming. She got her times mixed up, I think.
Okay. Hi, Nora.
Well, we might as well chat with her a bit, see if we.
Let's pretend we're just starting.
Poor Nora.
You there, Nora?
I'm trying to be.
Good. We're just kicking off here, so.
Oh, okay. Well, bye.
No, I mean,
no, Nora, come back.
Come back.
There I am. This is it?
Well go ahead, Lucas.
We started an hour and 15 minutes ago.
Okay. Eastern time. Okay. Hey, it's one of those days.
Hey.
My fourth Zoom meeting. So
we'll talk to you for a while.
We missed you.
Well, that's okay. I'm sure big decisions were made and I'll be fine with everything.
Yeah.
How's this time working out? How many people showed up?
We had about 15 this time.
That's less than the afternoon.
Yeah, it was.
I like the afternoon people.
But we're going to give it another try and see where we want to go.
Yeah, obviously, I'll be there the right time next time.
Good.
Well, we may want to stick around. You may not be the only one. We may get a flood.
I'll have to tell you, I'm presenting for the global division in Nigeria on Thursday, and
I've triple checked because it's 12 noon there and it's 4:45 a.m. on
Yeah.
Thursday. But I hope to God I've got the right. So now maybe I'll check again with people from Nigeria that are here. And so, yeah, unbelievable. Well, thank you for saying hi and goodbye. Hey, does anybody know what happened to Donna's son?
I think it was anorexia.
Oh, that's what, yeah.
Yeah, that's what it
Oh,
was.
that's
He'd been suffering from it for a while.
for years. Oh, my God.
Years.
Horrible,
Yeah.
horrible disease, horrible disease. I'm
Nice young
sorry.
man.
Yeah.
Other son had an
Shot,
accident
wasn't he shot or?
Oh, he was
beaten?
run over by a car
Yeah.
intentionally.
intentionally. Yeah.
Yeah,
So
she's
has
had a lot of
two
hardship within
children
the past.
or 3 children?
Two
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 boys.
boys.
Ooh, ooh. Yeah, bless her heart. Okay.
Yeah.
Well, thank
Okay.
you for telling me, and thank you all. I hope you have a great evening.
We hope you do too.
Thanks, Nora. We'll see you next week.
Yes, I'll be there, 5
Hey,
o'clock
Nora.
my time. Thanks.
Bye.
Thank
Nora,
you,
stick around
everyone.
For 1 second. And
Huh?
you two, stick around for 1 second.
Oh, okay.
Kristen, you too.
Okay, I'm leaving.
Okie dokie.
I need to stay or no?
Yeah, stay for a minute, Nora.
Okay.
Kristen, do you know Kristen?
I think we've met either on one of these or in passing at a
Who
conference.
knows?
Yeah.
Lucas, I mean, go ahead.
Kristen is, she's a COMS. She's on our staff. She's also an instructor. She worked for the VA for years. And she's been helping me out with the O&M seminars.
Oh, yeah.
For the last year and a bit. I think she did it maybe with us when we did it on the online one.
Yeah, you did. That's
Yeah.
where we saw each
That's right.
other. Yeah,
Right.
I was like, who is this?
So there you go. But so we've been talking about with Chelsea about the invitation for June. And we're more than willing to do it, but we just aren't confident that it will be doable, yet.
Right. I know that. I just wanted to get
Reserve the
dates
date.
down before Portland State University or University of Kentucky or whoever else nabbed you, because I know that's with Scott Crawford, that was an issue 2 years ago. The date I wanted, he had already booked it with Portland State University. And I said, how could Amy do that to me? Well, it wasn't Amy's fault. It was mine for being late. So,
You're always early, but we'll certainly commit to the date.
Right.
Whether we virtually or in person. I don't know. Who knows? We were wondering how you would know if you're going to be able to do it in person.
well, we know because we have to. If I don't, last year I canceled classes. And so that means a certain group of students actually had to reapply to Texas Tech because they were out for a year.
Wow.
So luckily the university paid their fees, because if you apply, you have to do reapplication fee and blah, blah, blah. So, but they had to do the whole application again to be accepted. They had to be accepted again. So we have to offer it. We will offer it.